Hello viewers, welcome to my new lecture. In this lecture we will talk about myocardial infarction and what are the different treatment protocol or dietary pattern which is usually followed. For example, if someone is uh, inflicted by the myocardial infarctions, so what actually happened there in myocardial infarction? So in myocardial infarction, there is death occur at the segment of the myocardium muscles. You know myocardium muscles, this is one of the strong muscle in the heart. And whenever the myocardials function or the myocardial contractility um, become slower, so the heart become unable to receive the blood and oxygen, and definitely ultimately there will be a formation of blood clot, or sometime you can see here on the screen there is cholesterol plaques formation or blood clot. And look at, these are the arteries, these are blocked here. So in myocardial infarction, when the death occur at the level of the myocardium muscles, so the heart muscles become unable to receive sufficient quantity of oxygen in order to maintain, or in order to the to supply the blood to the various parts of the body, so which is the physiological need. So look at an heart attack, which is what is actually happen here. So the coronary, these are the coronary arteries, and these are the healthy muscles, and these are the dying muscles. So that's so I have mentioned that in myocardial infarction there is occur death and the myocardium muscles. So this is actually the dying muscles, and these are the healthy muscles, and these are the coronary arteries. So this picture is taken from Encyclopedia Britannica. So sometimes there is occur blood clot formation, and sometimes there is plaques formation or cholesterol deposition occurs. So at that time the blood vessels they are congested, and definitely the myocardium muscles they are infarcts, and there is you can say they are not able to receive the adequate quantity of the oxygen. Let's proceed this lecture. Now come toward the dietary management of MI. So in case of myocardial infarction, when someone have myocardial infarction, so what will be the dietary management? How we can manage this case if a patient have MI attack. So after MI attack, so what kind of nutrients or what kind of dietary pattern that is required for the patient? So you know that after heart attack, the client is in shock. This is sure that whenever the heart attack occurred to the patient or the client, so the patient is in shock due to inadequate supply of blood to the heart, to the brain, and to the different parts of the body. So the client should be NPO, nothing by mouth. Mean you shouldn't give anything to the patient by mouth. Okay, so and the another way you can say the IV fluids may be given to the patient. The IV fluid, more and more IV fluid they are needed for the patient in order to maintain the electrolyte balance. So there, the first thing is that the patient is in shock, and the second thing is that the client should be NPO, mean nothing by mouth, and IV fluid should be given to the patient. This is the dietary management for MI patient. Okay. So after that, after several hours, when the client may begin to eat, mean the patient condition become normal. So the liquid diet usually recommended for first 24 hours. This is very important, very necessary, especially from a nursing care plan. You will have to provide the liquid dietary plan or the liquid diet, usually which is recommended for the first 24 hours. Then a low cholesterol diet or low sodium diet should be given to the patient, and as well as the food shouldn't be extremely hot or cold. So, means simply you can provide the liquid diet, which is usually recommended for the first 24 hours, neither hot or non cold food. Okay, but the diet must be free from cholesterol and having low sodium concentration in the diet. Okay, so another thing is the food that is easy to chew and digest, so it must be prescribed to the patient, and the sodium should be limited to prevent the fluid overload, because sometimes the fluid overloading occur over there and the sodium become retained, so it will cause high blood pressures and meaning more complication related to the human body system. While the restrictions on caffeine is the first few days after an MI mean that caffeine should be restricted in the first few days, mean after MI, after a take of myocardial infarctions, because that central nervous system caffeine, these are actually seen as central nervous system stimulant as well as depressant. So another case is congestive heart failure. So inshallah we will talk about the congestive heart failures and the dietary passion in my next lecture. So once again, I'm very thankful to all my students for watching this lecture, and please subscribe my channel and press the bell icon for upcoming videos. Thank you.